Hello there, this is Dr. Wu. I'm a doctor of physical therapist. Today I want to share with you with a case that I had recently. I discharged this patient, and it's a 40-ish patient with the neck pain. So the story is this patient had difficulty with the neck movement into different directions. So looking up, looking down, rotation left and right, and also sleeping on the left shoulder at night, causing a lot of pain and even the numbness tingling in the hand. And so this patient asked me if it's treatable, and my answer for that is yes. So he went through a lot of the other approach and does not seem to change that much. And he tried to work with other physical therapists, but did not get the result that he wanted. And after a while, he decided to come to see me. And so what I noticed is the range of motion is very limited, and the cause of that is because of the certain segments over here, more specifically about the C4 and 5, was not function. And because of that, we every time move it, the segment over here on the neck is actually pinched, and then there's a muscle here we call the scaling muscle from the C2 to C6, and they were attached over the rib, the first rib over here. And then between those, this muscle, the scaling has 3 bundles. So you have the anterior, you have the middle bundle, and you have the posterior bundle. But between the front and then the middle bundle over here, you have the nerve that from the C2 to C6 actually travel and then go all the way into your hand. And therefore, the patient might have the discomfort in the hand. So, and that's the trouble. This patient is very limited, and at work, he has to do the typing in the computer and talking to a client and turning, and that is very hard for him to rotate and then still doing things like that. And so what we have been trying is to do different approach by palpate the muscles. We do a retraction that doesn't take away of the pain. Then I did dry needling. So some of you might not know what dry needling is, so I'm going to explain to you. So dry needling, it means dry means that it's not wet, right? So it means that there's no medication involved. You just use the acupuncture needle and go directly into the specific muscles. And when the muscles are so angry, so tight, and then the needle in it will relieve it, and you will reset the sensors inside into this some of the knots, like a muscle knot in it. And so by doing so, then the muscle will more likely to calm down and reset it, and you will be not that angry, and then your brain might not feel a constant discomfort over there. Then the muscle will have a less chance of getting a lot of spasm there. Okay. And so we have been trying the dry needling to direct it to the scaling. Yeah, okay. And so, and this is not something that you would typically go to see acupuncturist and get it, because the acupuncture are looking for the acupoint. So acupoint is different. Acupoint is a point that it might have this physiological response by placing the needle into it. So that's different. I want to share with you to understand that. So basically, when we do this scaling needle in it, then immediately the patient might feel over the elbow, their area, a little bit hot, heaviness feeling. And that means that is typically at the level of the C4 and 5, okay? So radiating down, and then sometimes you might feel a little bit discomfort on the lower part distally in the fingers. Yeah, but for a couple minutes, then the discomfort should decrease. And after that, take the needle out, and we did a little bit stretching on this scaling muscles, which is rotation like this, and then side bending. So chin tuck, side bending, and rotate. Then you can get a little bit stretch in this one here. And sometimes we can you can also use a hand here to pull it, like this position. Then you can decrease the discomfort over there. But the thing I want to share with this case is that because it will decrease the spasm of the muscles, but that is the first step. You don't want to have the numbness tingling in there for too long. Then what we did is that to do a little bit gentle traction, yeah, to open it up, and then the joint will have a chance to open up a little bit. And plus, it might, if you have a little bit kind of forward or backward like this movement over here, kind of stuck over there. When you do the traction over here, you might have a chance to go back to the central position. And so that is the overall treatment there. And then the patient also had some headache. So like headache on the posterior part over here is causing a lot of discomfort. So we do also do the joint needling directly to the C1, C2 on the side here, directly to it, and then that decrease the headache, and immediately a couple times we immediately take the headache away, and a couple times it's actually decrease the discomfort. Okay, now this case is a very interesting case because a lot of patients out there might not know that this technique exists, and they might not know that combined with this manual CLP, combined with this joint needling technique and appropriate muscle exercise retraining, especially the deep neck flexors here, all the techniques to combine can cure this patient. And here's the result I want to share with you. Okay, so let's see. All right. So here's the result, and here's the feedback on the joint needling feedback form. And as you can see that the area that we did for the joint needling is the head, the neck, the shoulder. And then the feedback is I could feel the muscle twist and spasm, and then the pain subsided. All right, the process itself was normally not painful. And then about the question about what would you say to people with zero experience about joint needling, this is the feedback. It feels more specific than acupuncture, and it helped relieve pain in muscles that were knotted. All right, and we got a permission of posting this one online to help people understand what the joint needling is. And overall experience with me is 5 out of 5. And this is also recommend to, if you want to do any joint needling, you can always reach out to me. Yeah. So it's a process of understanding why the muscles is irritated, and then the joint alignment is not right, and the nerve being irritated. Okay, and then pull, and then we don't like to stay for too long. Okay, so if you have any trouble like that, or you know someone have the trouble like that, it might be a good idea for you to start thinking about maybe you should get the examination and to see if we can get rid of it. So the overall result for this case is that at the end, everything is good, no pain, able to sleep on the left shoulder, able to move all directions, no problem, no discomfort. The patient was able to do the engage the neck dip flexors muscles here for 20 seconds. And so very happy. And so I'm very happy to help this case. And then I have other patients that have similar diagnosis, similar presentation, and I just feel like, if you're suffering a condition like this and you wanted someone to take a look, you can always contact me, and I will give you free 20 minutes, free 20 minutes to let you see what can be done and what will be helpful. So if you happen to have any neck pain, with the, more specifically with the discomfort radiating to your shoulders and had a lot of troubles, don't give up. Okay, don't give up yet. Don't just say yes to the surgeon for the surgery, because the surgery could be helpful, but we want to use it as the last result. Okay. Again, this is Dr. Wu, and today we discussed a case with the neck and radiating pain all the way to the hand, and this is the case that I hope that help you understand. what dry needling can be done, and I hope everybody will get a treatment that they need and be able to participate a lot of things and do their work or do things at home without limitation. Okay? All right. Until next time, thank you.